Hi, my name's Helen. I'm an Associate Psychological Practitioner working for Greater Manchester Mental Health. I began working as a trainee Associate Psychological Practitioner, and that entailed working within clinic practice 4 days a week and then attending UCLan, the University of Central Lancashire, 1 day a week for training purposes. I also worked under the supervision of a clinical psychologist who I worked with once a week to just make sure that I was providing best care for the patients that I was working with. After a year of training, I then moved on to become an Associate Psychological Practitioner working within primary care full-time, and my clinical supervision reduced from 1 hour each week to once a fortnight. I felt like this role really supported my goals in terms of career progression when working within the psychological field. And something that I really thought was unique about this role is that we were working with clients in terms of preventing mental health deterioration and promoting good mental well-being, which is quite unique. So in a typical working day, I might conduct an initial assessment with a client to help understand their presenting problem in a more in-depth way. From the initial assessment, we would typically then move on to complete a formulation, which is almost like a jigsaw puzzle to understand how their problem is continuing and maintaining. And that would also help us to identify any interventions, so any skills or techniques that might help the person cope or manage their symptoms on a day-to-day basis. On paper, the Assistant Psychological Practitioner role looks at kind of working with people to prevent their mental health deteriorating and promote good mental well-being. However, in practice, what we're seeing is much more complexity. So the people who are falling between the gap of kind of not having a mental health problem that would be supported by talking therapy or being too complex for another service, we can fill that gap in terms of helping people cope with their mental health and manage their symptoms today, whilst we help them then seek the further support. At the end of working with clients, we ask them to fill out an evaluation form based on their experience of the Associate Psychological Practitioner pathway. From that feedback, we've identified that clients really value the time and space to talk to a mental health professional, especially in an environment that they are most comfortable with, which is their GP practice. A lot of clients have explained that if the support was available elsewhere, they would probably be less likely to engage. From the information that we've also gained from patients, we've realised that some patients, for example with anxiety, who were previously calling in work sick and seeing their GP on a weekly basis, are now no longer calling work sick or seeing their GP on a weekly basis for their anxiety, now that they understand why the anxiety is happening and how they can best manage that at home. I feel we have supported the primary care colleagues because we are an in-house source of referral for both mental health practitioners and GPs, which reduces workload. I'm also aware that one of my colleagues has delivered in-house training on the effectiveness of treating depression through therapy versus medication, which she identified to be very helpful.